Hi, my name is Munir. I'm a physiotherapist here at Alton Pain Clinic. Let me explain you how shoulder works. So, it's a complex joint, the only joint in our body which has 360-degree movement in it. No other joint can go all the way across other than the shoulder joint. It's a ball and socket joint. Ball is big and socket is small. That's why you got those rotator cuffs to hold the ball in one place. And when we move up, those rotator cuffs actually push the ball down, and that is how we create the full extension and full rotation. The first one is a supraspinatus, which lies in this cavity here in the scapula, goes underneath and attaches round here on the humerus. The other one is supraspinatus, which lies in this cavity here and then goes down and attaches on the top of the humerus again. Then you get a subscapularis, which lies underneath this scapula, comes out and attaches here, which is your internal rotator. And then teres major minors are down there, then they come and attach here. Shoulder joint also involves acromioclavicle joint. That's your clavicle and that's the acromion. That is another joint which can cause you sometime pain. We call it ACJ joint. The musculature. So, actual supraspinatus lies in this cavity here and then goes down and attaches on humerus here. Supraspinatus in this cavity goes down underneath the acromion and attaches on top of the humerus. Teres major minor goes from underneath, goes here, attaches here. Subscapularis, you can't see it because that's actually underneath this scapula and then comes out and attaches here. That is the basic anatomy of a shoulder. Now I'm going to show you how we examine that, how we assess each muscle and how we diagnose that what exactly is causing that nagging pain in your shoulder. Shoulder assessment. We'll start off with checking range of movement. Raise it up, 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 up. And at the end, we check the end feel. If end feel is a bit capsular, then we know the problem is coming from the capsule rather than any muscle itself. So that's the external rotation, that's the internal rotation, and then the abduction. So if one of the movement causes you pain, then we know it's coming from that particular movement. Now, checking the rotator cuffs, start off with abduction. Don't let me push down. That is supraspinatus. Go back, bend it here. Don't let me push outward. That is subscapularis. Don't let me push inward. That is infraspinatus. And then don't let me push down. Bicep tendon. Don't let me push up. Tricep tendon. Along with we do go across. We check if ACJ joint is causing you trouble, which is acromioclavicular joint. So these are simple movements we do to assess a shoulder. If one of the resisted testing is causing you pain, then we know that particular rotator cuff is playing up and we go on and then treat it.